This year's Mental Health Day theme talks about making mental health a global priority for all. WHO studies have shown that people who listen to music while they work, they tend to do better in mood and work more efficiently. Hello and welcome to another episode of Experts Speak at Talkspace. And I'm Dr. Sheba Singh, the founder of Talkspace, and I have a very special guest with me today. That is Jyotika Tangri, a celebrated Bollywood playback singer. Welcome to the show, Jyotika, and let's
Thank
talk
you so
about
much.
music. Yeah.
Absolutely. Thank you so much for the lovely introduction. And I'm so glad that I'm on your show and we'll be talking something really important, some really important things and some things that I'll also get to learn. So it's really, really nice to be here.
Thank you so much for taking out time, Jyotika. Yeah. So, when we talk about music, uh, I know music helps a lot in mental health to keep ourselves sane. It helps a lot. And we have so many music therapies also, which are very systematic and help us a lot when we deal with patients. So, help me understand, Jyotika, how do you take care of yourself? How do you take care of your mental health?
So me being a musician, I think music is something that rescues me from everything, from every kind of difficulty that I have in my life, and if all kind of phases. I have my own kind of songs, my own kind of music that I take help from, and then it pulls me back to do good and to be energetic and to put myself back together from any situation. So for me, it's music, and also there are some other things that I really like to do. So I try to, put myself to that, to like throw myself to that way so that I can, feel better in something. Because you being a musician, there are definitely so many times that, we go through a lot of things. There are some times of the year that we do not have work. Being a freelancer, not doing a job, which will provide me a monthly salary or something. I have no security from the financial aspect, as well as
Yeah.
I have to keep proving myself again and again. If I give a hit song, that doesn't mean that it's gonna be giving me that kind of work and fame and everything throughout my life. I have to keep doing things again and again to be there, so that people can remember me, so that I can keep working, keep getting work. So these kind of things I have to face, and I'm sure and my fellow musicians also have lots of things that they go through. And yeah, things that I like to do pull me back from all those situations.
Definitely. Yes. So yes, like you said, Jyotika, that you are the film industry and music industry. Uh, our youngsters look up to you, because you are successful people. They look up to you. Say you are their role model sometimes, and they want to be like you. You know, and it's really very heartbreaking when we see people harming themselves in your industry, and I'm sure there must be many reasons for that, you know but then it's difficult to see, that people are harming themselves and people are sick and mentally not healthy while they're working, while they're leading
Right.
our youngsters, the new generation, you know um, I think, what do you think, Jyotika? How can we as mental health professionals help your industry to be to be sane, to be normally working, or to help them in leading a better life, and what can our government do, if you have any suggestions?
I feel, first of all, so many of us don't even know that we're going through something which is a mental illness or something, which is uh, not feeling right. We don't understand completely that what is wrong with us. If probably, there are certain things which are, really hurting you. And there are a lot of things that are going on in your mind, and you cannot just function properly, and you're not there in the moment. And these things are really important for people like us, musicians especially, because we have a lot of mind thinking to do. We have a create, like all the creativity that happens, we have to keep our minds really clear, and have that space where we can create something new. And even to sing something for a composer or anything, you have to understand those things, and the mind should be really on the right path. And when there's a term in artists world, in the musicians especially, they say an artist block. And even I have been through, and I know a lot of people who have been through all this. So in that situation, you start feeling like that, you're forgetting what you know, you are not being able to perform the way you used to. And things like that are really really disturbing. So first of all, to understand that, yeah, you're going through that artist block, and then taking yourself out of it and asking for help is one of the things that you can do. So these things are actually something that really need to be enlightened. People should get to know that if you're going through something like this, you need help, and don't feel shy, and don't keep it to yourself. You can
Right.
get
So
help.
awareness
So I think these
awareness
are
is
some
very
things that,
important. Right.
that's right, that's the word, right?
Yeah. So yes, awareness is very, very important. How do you think we can create more awareness among people, so that they understand what's going on with them?
Right. I feel social media is one of the biggest things right now, and mostly everybody, all the youngsters, and even all kind of like all generations are on social media. Maybe Facebook, Instagram, Twitter. So I think that's a very good platform to promote things like these, and to spread awareness. And I think some campaigns maybe you can plan. And even I, like, if you guys need me anywhere, I would really like to promote and help you
That's
guys, support you in this, because it's a really really noble cause that you are doing. And I would like to actually congratulate you guys, because people usually do not think about these things, other than you're a doctor and you must be practicing regularly, but you are taking out time to think of these things and doing something for this. So that's really nice.
Thank you. Thank you so much for acknowledging. Yeah. So yes, awareness. That's a great point, Jyotika. Definitely, awareness would help. Till the time you don't know what's happening with you, how will you reach out to somebody? You know,
Right.
you when you have a fracture, when you have pain in your eye or your leg or hand or limbs, any other place in your body, you know where to go. So if there is an eye infection, you go to an
Correct.
ophthalmologist, But then when you have worry, so you're fearing something which is out of proportion, you don't know where to go. And people around you would say that this is a phase,
Correct.
this is just go away, you know. So people don't know what to do if
Yeah.
this happens to them, you know. So people would say घबराहट हो रही है, but
Right.
where to go if घबराहट हो रही है, you know. So that's not a
Say what?
phase, definitely. It's not a phase. So
Mm-hmm.
if you have any kind of fear or if you have any kind of anxiety or sadness, that will grow. That will not go on its own. That needs treatment. This is again a medical condition. You know? Yeah. So
Mm-hmm.
you rightly said that awareness is very, very important. What else do you think, Jyotika, government can do to help us?
Um, I think government can probably, I don't know. Again, it comes to awareness only, and then normalizing these things, because in the society there is a fear and a different kind of a mentality people have, that if a person is seeking help from a psychologist or psychiatrist, they call them पागल है, या फिर क्या हो गया, इसका दिमाग में कुछ तो issue है, या इनसे दूर रहो, इनके साथ दोस्ती नहीं करना है. So I think these kind of things are supposed to be normalized. People should be talking freely, and probably for the filmmakers also, they can make films which are on the topics which are promoting these kind of things and normalizing these things. Like people have done that, and I think uske baad काफी सारा फर्क आया भी है. I know a few friends जो हेल्प लेते हैं एंड दे टॉक अबाउट इट फ्रीली, उनको ऐसा नहीं लगता बात करते हुए कि अरे यार मेरे दोस्त क्या सोचेंगे मेरे बारे में. सो आई थिंक दीज आर द थिंग्स. एंड बाकी गवर्नमेंट को क्या करना चाहिए, आई थिंक you can also like you should you tell me about this because I am also one of those people जिसको सीखना है बहुत कुछ इसके बारे में. I'm not an expert who knows a lot about this. I can definitely tell you about the worries, the things that my fellow musicians and me go through.
Right.
Yeah, we are
So
here
you
to seek help.
you would yeah. So you would know, Jyotika, there's a bill just passed where they say that earlier it was not, mental health was not included in the insurance part. Now it is included in insurance. So earlier people used to think that this is very expensive and they cannot afford it. So I think government should make it affordable so that
True.
everybody has access to it. So many students come to us, suppose, and they say that they are not earning, and they take money from their parents only. But then when they have to come for therapy, they don't tell their parents that they want therapy and they need money for therapy,
Right.
and they are not earning also. So we have come up with a segment at Talkspace, which is an affordable segment for only students, which is
That's great.
very, very affordable. Yes. So I think government should also take some initiatives to make therapy more affordable, and should run more campaigns, should show more symptoms on the television. Like you said,
Right.
social media is a great place to spread awareness. I think government
Right.
can also take some steps to spread more awareness through these channels. So, like that, and people would be more aware. See, even if they are aware now, they think that it's very expensive and you can't go there, because this is not only a single session. You have to go multiple sessions for the same complaint. So that's how I
Right.
think yeah, government can also help us.
Definitely, I think that'll be really nice and a good way to do it, because then it'll be feasible. Everybody can think about it. Okay, if I'm having something like that, some symptoms, and I can go and seek help from a doctor, from a therapist.
Correct. Exactly. Exactly. So okay. Uh, एक क्वेश्चन पंजाबी च पूछांगी.
बिल्कुल पूछ लो जी.
Because म्यूजिक का पंजाबी म्यूजिक अपने आप ही बहुत थेरेपेटिक है. तो एक गाना सुना दो साढ़े पसंद दा ते एक गाना सुना दो अपने पसंद.
अरे वाह, जरूर जरूर जी. पसंद है, दसो केड़ा.
सारी रात.
अरे वाह. आई थिंक ਇਹ ਗੀਤ ਜਿਹੜਾ ਸੌਂਗ ਮਤਲਬ ਬਚਪਨ ਤੋਂ ਮੈਂ ਵੀ ਸੁਣਦੀ ਆਈ, ਬਿਕਾਜ਼ ਇਟਸ ਅ ਕਲਾਸਿਕ ਮੈਲੋਡੀ ਤੇ ਸਾਰਿਆਂ ਨੂੰ ਬਹੁਤ ਪਸੰਦ ਆਉਂਦੀ ਹੈ. ਮੈਂ ਆਪ ਇਹਨੂੰ ਇੰਨਾ ਸੁਣ ਕੇ ਖੁਸ਼ ਹੁੰਦੀ ਰਹੀ ਹਾਂ. ਬਚਪਨ ਚ ਯਾਦ ਕਰਦੇ ਸੀ ਆਪਾਂ ਕੰਪੀਟੀਸ਼ਨਸ ਚ ਗਾਣਾ ਤੇ ਗਾਣੇ ਹੁੰਦੇ ਸੀ, ਬਟ ਆਈ ਨੈਵਰ ਥੌਟ ਕਿ ਮੇਰਾ ਵੀ ਕਦੀ ਆਪਣਾ ਇੱਕ ਵਰਜਨ ਇਸ ਤਰ੍ਹਾਂ ਦਾ ਰਿਲੀਜ਼ ਹੋਏਗਾ ਤੇ ਤੁਸੀਂ ਸਾਰੇ ਮੈਨੂੰ ਇੰਨਾ ਪਿਆਰ ਦਿਓਗੇ. ਸੋ
And
ਆਈ
that's
ਐਮ
a
ਰੀਲੀ
lovely, lovely
ਰੀਲੀ
version. बहुत ही प्यारा
ਥੈਂਕ ਯੂ.
गाया ਤੁਸੀਂ.
थैंक यू. सो हेड गोस दो लाइना ਤੁਹਾਡੇ ਸਾਰੇ ਪਾਸ. सारी रात तेरा तक नियरा, तारियां तो पुछ चनवे. सारी रात तेरा तक नियरा, तारियां तो पुछ चनवे. वे मैं तेरे लिए होइया तबाह, लारियां तो पुछ चनवे. ओ वे मैं तेरे पिछे होइया तबाह, लारियां तो पुछ चनवे. सारी रात तेरा तक नियरा, तारियां तो पुछ चनवे. सारी रात तेरा तक नियरा, तारियां तो पुछ चनवे. Thank you. Thank you so
Beautiful.
much.
Lovely, lovely. Music is therapeutic.
It is, definitely it is.
बिल्कुल.
Okay.
ਇੰਨੇ ਸਾਰੇ
आप
ਗਾਣੇ ਤੁਸੀਂ ਗਾਏ हैं. ਤੁਸੀਂ ਆਪਣੀ ਪਸੰਦ ਦਾ ਵੀ ਸੁਣਾਓ।
ਠੀਕ ਹੈ। ਸੋ ਜਿੰਨੇ ਗਾਣੇ ਗਾਣ ਦਾ ਮੈਨੂੰ ਮੌਕਾ ਮਿਲਿਆ ਹੈ ਉਹਨਾਂ ਸਾਰਿਆਂ ਵਿੱਚੋਂ ਵੀ ਮੇਰੇ ਫੇਵਰਿਟਸ ਇੱਕ ਦੋ ਹੈਗੇ ਨੇ ਜੋ ਮੈਨੂੰ ਇੰਨੇ ਪਸੰਦ ਹੈ ਕਿ ਮਤਲਬ ਅੱਛਾ ਲੱਗਦਾ ਹੈ। ਕੋਈ ਹੁੰਦਾ ਨਾ ਇੱਕ ਆਪਣੇ ਖੁਦ ਦਾ ਪਸੰਦ ਹੋਣ ਵਾਲਾ ਗਾਣਾ, ਉਹ ਵੀ ਹੈ। ਬਾਕੀ ਜੇਕਰ ਤੁਸੀਂ ਚਾਹੋ ਤੇ ਮੈਂ ਆਪਣੀ ਕੋਈ ਹੋਰ ਦੂਸਰੀ ਜਿਹੜੀ ਮੈਂ ਸੁਣਦੀ ਆਂ ਜਾਂ ਬਚਪਨ ਤੋਂ ਉਹਨਾਂ ਵਿੱਚੋਂ ਕੋਈ ਸੁਣਾ ਸਕਦੀ ਹੈ। ਦੈਟਸ ਯੋਰ ਚੋਇਸ, ਯੂ ਲੈਟ ਮੀ ਨੋ
ਕੋਈ
ਵਿਚ
ਵੀ
ਵਨ।
ਜੋ ਤੁਹਾਨੂੰ ਬਹੁਤ ਪਸੰਦ ਹੈ, ਜੋ ਤੁਹਾਨੂੰ ਪਸੰਦ ਹੈ।
ਤੇ ਇੱਕ ਗਾਣਾ ਹੈ ਜਿਹੜਾ ਮੈਨੂੰ ਬੰਬੇ ਤੱਕ ਲੈ ਆਇਆ, ਮੈਂ ਉਹ ਵਾਲਾ ਗਾਣਾ ਤੁਹਾਨੂੰ ਸੁਣਾ ਦਿੰਦੀ ਹਾਂ।
ਬਿਲਕੁਲ ਜ਼ਰੂਰ।
ਅਲਫਲਾ ਚੰਬੇ ਦੀ ਬੂਟੀ ਜੀ ਮੇਰੇ ਮੁਰਸ਼ਦ ਮਨ ਵਿੱਚ ਲਾਈ ਨਫੀ ਇਸ ਬਾਤ ਦਾ ਪਾਣੀ ਦੇ ਕੇ बूटी हर रगे हर जाई हो जुग जुग जीवे जुग जुग जीवे मेरा मुर्शिद सोना तेज से बूटी लाई हूँ पीर मेरे आह जुगनी जी है वे अल्लाह वाले दी जुगनी जी है वे मेरे पीर दी जुगनी जी है वे सारे सब्ज दी जुगनी जी है वे नबी पाक दी जुगनी जी है वे मौला अली वाली जुगनी जी है वे सारे सब्ज दी जुगनी जी है वे मेरे पीर दी जुगनी जी।
Wow, beautiful, beautiful.
Thank you.
Very nice, very nice. Thank you so much, Jyotika. These were
Thank you.
lovely songs, beautiful songs.
Thank you.
ਅਸੀਂ ਤੁਹਾਨੂੰ ਵੈਸੇ ਹੀ ਬਹੁਤ ਸੁਣਦੇ ਰਹਿੰਦੇ ਹਾਂ।
ਅੱਛਾ ਜੀ, ਥੈਂਕ ਯੂ। ਮੈਨੂੰ
ਬਹੁਤ
ਬਹੁਤ ਖੁਸ਼ੀ ਹੁੰਦੀ ਹੈ ਜਦੋਂ ਮੈਨੂੰ ਪਤਾ ਲੱਗਦਾ ਕਿ ਮੈਨੂੰ ਇੰਨਾ ਸਾਰਾ ਪਿਆਰ ਮਿਲਿਆ, ਤੁਸੀਂ ਮੇਰੇ ਗਾਣੇ ਪਸੰਦ ਕਰ ਰਹੇ ਹੋ। ਬਸ ਇਸ ਤੋਂ ਜ਼ਿਆਦਾ ਵੱਡੀ ਕੋਈ ਖੁਸ਼ੀ ਕੀ ਹੋ ਸਕਦੀ ਕਿਸੇ ਸਿੰਗਰ
ਤੁਹਾਡਾ
ਵਾਸਤੇ।
ਲੇਟੈਸਟ ਜਿਹੜਾ ਬਾਜਰੇ ਦਾ ਸਿੱਟਾ, ਬਿਲਕੁਲ ਬਿਲਕੁਲ। ਤੇ ਬਾਜਰੇ ਦਾ ਸਿੱਟਾ ਜਿਹੜੇ ਗਾਣੇ ਆਏ ਆ ਤੁਹਾਡੇ ਬਹੁਤ ਹੀ ਪਸੰਦ ਹੈ ਸਾਰੇ, ਬਹੁਤ ਬਹੁਤ ਅੱਛੇ ਗਾਏ ਹੈ, ਬਹੁਤ ਹੀ ਪਿਆਰੇ। ਵੈਰੀ ਨਾਈਸ, ਥੈਂਕ ਯੂ ਸੋ ਮਚ ਫॉर दैट। And thank you so much
ਬਾਕੀ
for taking.
Before ending this session, I would really like to tell you all about something कि मैं अपने YouTube channel पे एक नवा song लेके आ रही हूँ बहुत जल्दी।
अच्छा।
So in November, probably 4th of November is gonna release. But सारी updates मैं अपनी social media पे पा रही हूँ regularly. जरूर मैंने follow करियो। ते उस गाने का नाम है कमली, and it's very close to my heart because I've written this song, I've composed it, I've sung it, and you can also see me in the video. So बहुत बहुत excited हूँ मैं इस गाने वास्ते। So I would really like to appeal all the viewers watching me right now to please go subscribe to my YouTube channel, and बहुत सारा प्यार मैंने ਤੁਹਾਡੇ ਵੱਲੋਂ ਚਾਹੀਦਾ ਹੋਏਗਾ ਆਪਣੇ ਇਸ ਗਾਣੇ ਵਾਸਤੇ। So thank you.
Sure, definitely जी, all the best to you.
Thank you.
And thank you so much for taking out time today, Jyotika. And that was lovely, lovely talking to you. And we'll support you. You support mental health. And please talk more and more about it so that people become aware and and we are all reachable. All mental health professionals are reachable. They can come reach out to us anytime. But don't live in suffering. Don't suffer unnecessarily when treatment is available.
Right.
Yeah. Okay. Thank you so much, Jyotika.
Thank
nice
you.
having you over our show. Thank you so much.